This is the moment Stephen Monaco has endured time and again in his 27 years. Wheeled into a recovery room at Children's National, waking up from yet another surgery to fix a body
I know.
ravaged by a rare disease called isovaleric acidemia, or IVA.
Are you feeling better?
In Stephen's case, it's a condition that requires round-the-clock care.
I know that hurts, huh?
The injustice here, according to his mother, Jana, is that it did not have to be this way.
The consequences of not being screened early are never ending. It's lifelong.
This is Stephen at 3½, a happy and seemingly healthy child. But the day after this photo was taken, he fell into a coma and suffered a severe brain injury due to an undiagnosed metabolic condition that should have been identified the day he was born.
When Stephen was born, Virginia was screening for 8 conditions, and IVA was not one of them, and so it went missed.
If caught early, Stephen would have led an ordinary life with routine monitoring and medication, like his younger sister, who also has IVA. Caroline rides horses competitively and is currently a senior in college. Unlike her big brother, she was screened for this genetic mutation.
That changed the course of her life. That set her on the path that Stephen started on.
In the early 2000s, an expert in pediatric genetics, Dr. Michelle Puryear,
I formed the committee.
founded the Advisory Committee on Heritable Disorders in Newborns and Children while working at HHS.
People wanted this. The public health programs wanted this.
This federal advisory committee does the work of determining which rare diseases newborns should be tested for. They also do the heavy lifting of research and determining treatments. Today, babies are tested for nearly 60 conditions at birth, giving 14,000 children born with a rare genetic disorder every year the chance to live their best lives.
Newborn screening is the single most effective public health intervention ever.
Dr. Ada Hamish is clinical director of the Department of Genetic Medicine at Johns Hopkins University.
The committee has changed the landscape of newborn screening in this country.
But now the advisory committee behind these newborn screening recommendations has fallen victim to White House cost cutting. And it happened only days before the committee was expected to approve the addition of 2 rare diseases to its list. A spokesperson for HHS tells 7 News that committee was terminated because it was considered, quote, unnecessary.
Wow. I would like for them to be here with Stephen right now and tell me that it's unnecessary. I know. Let me cover you up.
For nearly 30 years now, 2 things get Jana Monaco out of bed every day: caring for Stephen
It'll get better.
and pushing to expand newborn screenings to protect other families like hers.
I will continue to share Stephen's experience to help people understand this is what you're setting up to happen without this committee.